Good evening, everybody, and welcome to our Community Hospital Association's special interest discussion this evening. My name is Sue Greenwood and I am a member of the Community Hospital Committee. I'd just like to introduce other people. Helen Tucker is with us and she is our president. We have Janita and Sally, who are going to be presenting to you tonight about their award-winning wound management and nurse associate topics. So is there anybody there that wants to say hello to us, just so we know who we're talking to? Kylie? No.
Sorry, I'm trying to take myself off mute. Hello. I'm here. So my name's Kylie Locke. I'm the quality lead. So I have the pleasure of supporting Sue and Sally and Janita and their teams and seeing what amazing improvement works that they do. So I know all about this project, but it's still lovely to come along and just show support and kind of hear what they're up to. So yeah.
That's lovely. Thank you, Kylie. Welcome. And Marion?
Hi, my name's Maria. I feel like I'm completely out of area here. I'm based in, well, I work between Portsmouth and Bognor Regis, so quite far away from you guys. And I work for a private company, and we are very much looking at standards, and I guess not just maintaining standards, but benchmarking. So very interested in what you have to say and what we could learn.
Oh, thank you.
Oh. Well, welcome, and it's lovely to have you here. Yeah. So, without further ado, what we plan to do is happy for you to ask questions anytime throughout the time that we share together. So, if you want to, just stick your hand up, and I'll try and keep an eye on everything and let people in. So, Sally, if you'd like to introduce yourself, we'll start.
Of course, thank you very much. My name's Sally Oxley. I work with Sue at Camborne Redruth Hospital as the outpatient lead, which is a job I've been doing for the last 15 years, not leading it, but working in the department, and I absolutely love it. So I'm really proud to be here today to talk to you about our amazing wound management clinic. So firstly, I would like to thank the CHA for our award. Janita actually was involved in the original process of when we first applied, so I'm really pleased that she could join me today for this. We're really honoured, and it's really nice that our work is recognised outside of the trust. We're really proud, so thank you very much. So a little bit of a history of the wound management clinic. So it's seen quite a lot of changes over the years. So bear with me and I shall bring it up. So it's part, as I said, it's part of the outpatient services here at Camborne Redruth Hospital, and it was initially established in 2002 as a weekend service for practice nurse patients who were struggling to manage the whole weekend without wound care. District nurses were referred to them, and the district nurses could not take on the additional capacity of these patients as well. So the clinic was set up to run it from the outpatient department. Instantly successful, as I'm sure you can imagine, and it soon grew into a daily morning clinic. I joined the outpatient team in 2008, coming from a tissue viability nurse background in Essex. I trained and worked at Southend Hospital for 10 years. And although the service was already really successful and well received, I could see the potential it had. It was obvious right from the start for me. So soon, with the local PCN and the trust support, we extended the clinic to run all day, every day, 8 o'clock in the morning till 5 o'clock in the afternoon, 7 days a week. We did initially try evening appointments running until 7 o'clock, but they really didn't prove very popular, which we were quite surprised at. So the additional resources went into running more early morning appointments for patients before work, which have been and are still now very popular. So we provide 50 appointments a day, and the outpatient nursing team are rotated in and out of the clinic as required. So all the nurses that work in outpatients, for a team of 18, are all able and competent to work in the wound management clinic. So we treat all wounds and all ages. For example, yesterday we treated a 1-year-old post-op patient and a 99-year-old gentleman with a leg ulcer. So we really are cradle to grave type NHS. So I do want to mention, though, that I'm here, myself and Janita are here talking to you today about our clinic, but it is a real massive team effort. We've got myself as team lead. We have registered nurses, registered nursing associates and healthcare assistants. We have a brilliant matron. I know she's here listening to me, but she is brilliant. And we have also a great reception, portering and domestic team. So all individually really contribute, as I'm sure, to all services across the NHS. But without them, we couldn't do the job we do. So the wound management clinic isn't actually a standalone service, which we would love it to be, but it is part of the outpatient services provided at CRCH. And as a department, we see about 3,000 patients a month coming through the doors. And for a outpatient department in Cornwall, that's a lot. So we're a fairly big department. So the wound management clinic at the moment has always been a bit of a step ahead of the game, we like to think. But from now on, we are being guided by the National Wound Care Strategy Programme. And I'm really pleased that Kylie Locke's on the call with me in case I get any questions about the National Wound Care Strategy that I don't know, because she's become quite an expert in it herself. So the strategy promotes excellence for every patient, every time, and our ethos within the clinic is to treat everyone with respect and dignity, providing non-judgmental care, taking into consideration personal circumstances. As a team lead, I very much promote a positive clinic environment where matron often walks past and comments on how much laughing and happiness that she hears coming from our department, because I very much promote happiness, singing, dancing. There was waltzing going on today at one point with a HO and a patient, which was quite hilarious to see. Patients enjoy coming in, and if they're positive, they often have a positive outcome. A lot of the patients that we're seeing are becoming more and more complex. GP appointments are few and far between, unfortunately, and a lot of our elderly patients can't keep up with the modern world of technology. We had a patient come in today who needed help to send in photographs to his GP, and that's what hopefully they would come to us and we could help them with. So in tandem with our regular daily clinic, we also run a weekly leg maintenance clinic, which is coordinated by one of our healthcare assistants. And this was established back in January of this year. It's been running for just under a year. The clinic was instigated to try and support patients with leg ulcers who were not maintaining good care of their legs post-discharge. So coming into a management clinic, we're getting them beautifully healed, they're being discharged, and they're coming back within 3 months with more leg ulcers. Anyone that is involved with compression hosiery would be fully aware how difficult it is to get on and off for even the most able-bodied person. So a lot of people just needed a few teaching sessions. They could go off on their own and do it. And some patients just found it very difficult to maintain good skincare, to even wash their legs or apply moisturiser. And hopefully we'll be able to give them the confidence and teach them the skills to do this. There is a big gap in care, unfortunately. I'm not sure if it's just relevant to Cornwall, but patients who are discharged from care, there's no follow-up. The GPs can't see them just to wash and cream their legs and put their hosiery on. Unless patients are prepared to pay for private care or have carers going in for other reasons, there's a real gap. I mean, this sort of care we consider to be vital, and it's that basic nursing care that I do think often gets overlooked these days. And picking up, and it's not necessarily going to prevent reoccurrence, and we know that, but if we can pick up on early signs of reoccurrence, we can prevent patient suffering in nursing time. To further develop our knowledge and our understanding, our staff liaise with company representatives frequently to learn more about new clinical products and formularies. So we're very lucky to have very close links with our Medi rep, who supplies all our compression hosiery and compression stockings. They're really good about coming in once a month and giving us teaching sessions and keeping us up to date and actually seeing patients as well who we're struggling with. So we also are very, very close links with our local tissue viability team, and they're very good. The training that CFT provides any nurses or clinicians within CFT is absolutely brilliant. And we have the luxury of the tissue viability nursing associate, Charlie, visiting us once a month. And she has a planned day each day once a month, and we keep all the complex patients for her. And she comes in then and she reviews them in clinic. We've also very recently been gifted, which hasn't actually arrived yet, a brand new messy ABPI machine from the Hospital's Guild of Friends. We do have an ABPI machine, but it's old and doesn't work very well. So we're really excited that this is a very modern bit of kit that's going to be able to measure ABPIs really quickly and efficiently with minimal inconvenience to the patients. So to do a proper Doppler in the old-fashioned way would take you up to an hour. This can do it in 10 minutes. So that's a massive saving of nursing time. So we've also got really good links with our local GPs. So to attend the wound management clinic at CRCH, you have to be registered with one of the North Terrier area of Cornwall GP services. And we have to use them quite a lot. We have to communicate well with them because then anything that needs prescribing for the patient obviously has to come from them. I would like in the future to one of the teams become a nurse prescriber. That's something that we need to move into, I think. But at the moment, it's still our GPs we have to go to. So we also are very close links with our research team in CFT, and we're taking part currently in a couple of different research studies, one being the Venus 6 randomized compression study, and there's also currently a dressing study going on comparing two different dressings alike but from different companies. And that's really opened my eyes a lot to research, and also gained the nurses, really good experience with research who maybe haven't had that before. So we do promote a lot of research within the team, and our regular patients are always more than happy to take part once it's been explained to them. So I also consider the department to be very much a teaching service. We have a lot of students. Currently have our three nursing students of our own and a nursing apprentice. And we've also got a work experience student from Cornwall College who only started on Monday, and I'm not quite sure she knows what she got herself into, but she's very sweet and I'm sure she'll be fine. And we also, we provide intense wound care to patients with the 50 patients a day that we see. So we have a lot of new staff from CFT come and do placement days with us just to upgrade their knowledge on their wound care and keep it up to date with the National Wound Care Strategy, which we're always happy to facilitate as well. So for me, what lies at the heart of the wound management clinic is the importance of making it a happy and caring and happy environment. I think you can have a clinic that has all the up-to-date equipment, all the up-to-date knowledge, but if you haven't got that happy and caring atmosphere that makes patients feel safe, it's not going to work. So that's that's how I tend to try and lead the team, to provide that sort of environment. And patients love coming in. They're always quite disappointed when their wounds are healed, which is always quite a nice reflection on the care that we provide. So as a team, we do strive to provide compassionate care, and we have a lot of patients who really, really struggled through COVID and are really struggling because of the cost of living crisis they're going through now. So we do have a little second-hand box of clothes that contain things like clean socks, gloves and scarves and tracksuit bottoms, because patients do come in a bit of a state sometimes. Our two wards at CRCH are very good at lending us or giving us clothes and even a pair of pyjamas for a person once that was really struggling. So also during COVID, some of the staff making up food parcels for patients, which was really, really nice because patients were struggling. And we do have a lot of homeless people on our books as well. So we do try and look after them the best we can and signpost them to the appropriate people that can help them further. So patients with leg ulcers do tend to stay on the books for a long, long time. And we get to know them, and they'll talk about their issues with us, and they'll talk about any problems they have, and we can then signpost them on to the correct organisation. So it really is holistic care. So that's me about my lovely clinic. So if I could hand on over to Janita now to talk about her nursing associate role and a little bit more facts and figures about leg ulcers.
Absolutely. Thanks, Sally. I didn't know if anyone had any questions for Sally or if
yeah, sorry, I forgot that.
If not now, then we'll save some for the end. Right, okay, so Janita, if you want to go ahead.
Lovely stuff. I'm just going to go ahead and share my screen, and hopefully you can all see what I'm seeing. Stuff, brilliant. So good evening, everybody. It's really lovely to see so many people here tonight and giving up your time. My name's Janita, and I am a fairly recently registered nursing associate. I qualified last year, and I work with Sally and the team at the wound management clinic within the outpatients department at CRCH. And I've very kindly been invited here this evening to just share a little bit about my nursing journey within the clinic, sort of how I got to where I am today, and future plans for the clinic. So as Sally has very eloquently put already, you know, our clinic is making waves. You know, we're a nurse-led clinic guided by the National Wound Care Strategy Programme, always promoting excellence for every patient every time. And we do look, as Sally mentioned, really to holistically care for our patients, no matter what their sort of circumstances, their background, or what wounds they're coming to us with. We aim to treat every patient with care and compassion, and the importance of compassionate leadership is definitely demonstrated within our team as well.
Thank you, Jen.
You're welcome. So a little bit about our clinic. So again, sort of reiterating just what Sally said, our mission is always about promoting person-centered care and independence, actually, post sort of seeing us in our clinics as well. We see mainly leg ulcers and venous leg ulceration, and again, it's working with our patients together to holistically manage their wounds. So a couple of the many advantages of our clinic is that we have a brilliant team, all very varied in their skill sets, but every member is always encouraged to expand their skill sets. And as Sally mentioned, the training opportunities are endless and they're really, really remarkable within CFT. And we get the opportunities to demonstrate the skills that we learn. So a couple of examples are toe pressure assessments, Doppler assessments, and as well applying compression therapy, which it typically is down to the role of a nurse or a nursing associate, but many of our healthcare assistants are brilliant and can also do that. So that just goes to show the wide and varied skill set of our team. And again, as mentioned, we're a 7-day service, even operating on bank holidays. People always still seem surprised to hear that we're open on weekends, but wounds don't just magically heal because it's a Saturday. So, you know, it's something we really pride ourselves on, you know, providing that year-round service all day, every day. And we love what we do. So a couple of just hard-hitting numbers. So these are figures based from 2017 to 2018, but they're still very much relevant today, 5 years on. The estimated annual NHS costs of all wound management was estimated at around £8.3 billion, which is obviously huge. And of that, 5.6 billion was all associated with managing non-healing wounds. So those are huge numbers, and you know, they're costing the NHS billions of pounds even. And it's interesting to see that 81% of the total cost was incurred within the community. So coming from a community sort of setting, a community hospital, it's really interesting to see how we can try and manage those numbers and hopefully bring them down. That's the aim, at least. And then a little quote that I saw that I just quite enjoyed and wanted to pop in by Robin Carlson. We look at the whole patient and not just the hole in the patient, which I find quite funny, but actually so true. It goes back to that holistic care that we endeavour to give. And we really get to build a rapport with our patients. Many of our patients, although some come in for sort of day cases almost, and they're in and out in 20 minutes, we do see a lot of patients who are on our caseloads for months, even years. And we really get to build those rapports with them, find out a bit more about them, their families, their backgrounds. And, you know, as Sally mentioned, some of them are really sad to be leaving when they're all healed up. So I think that's just testament to our team and the care we provide. So yeah, again, just briefly covering the sort of area of work within that we cover, and during my training, I found this to be really useful, working in these different areas as well. Working obviously primarily in wound care in the wound management clinic, in conjunction with the fairly newly formed leg maintenance clinic that was established at the start of the year. So it's nearing its 1-year anniversary, and it's taken off, and it's doing so well. It was actually initiated by one of our healthcare assistants. She came up with a brilliant idea, and it's taken off. And our patients love coming to it. And again, it's all about promoting independence after they sort of leave the main wound management clinic. And yeah, it's doing really well, and it's yeah, well received. And of course, working with the research teams and tissue viability teams, we get to, again, it's all about enhancing that skill set, widening that knowledge, and utilizing what they can provide us to enhance patient outcomes. So we utilize the formularies established by the tissue viability team, and we work with the research team on projects, actively currently in 2 projects at the moment. And again, that the importance of evidence-based care is paramount. So it's really useful to be able to work with these teams to support our patients. And just an interesting sort of figure that we've been able to roughly collate from our findings within our clinic, there's a 30% reoccurrence rate of leg ulcers in our patients, which it's inevitable, as Sally mentioned, but we're endeavouring to bring that down. So it'd be really interesting to look back once we've sort of moved on to a digital note-taking site like Rio, or system like Rio, sorry, and to see if hopefully in the coming years we can bring that figure down. And then, of course, about patient care, we work with many teams. Podiatry is also included in that, so we work really closely with them, with a lot of our sort of diabetic patients, especially, who have issues with their feet and maintaining good sort of skin integrity with their feet, and we share care with them as well, and it's very much a 2-way sort of system. They're really helpful with referrals and whatnot, and we can very often go to them seeking advice and help, and they're very willing to help us out and support us. And just going back to sort of the environment that we pride ourselves on creating for our patients, we very often ask patients to fill out friends and family tests or questionnaires, and the results of all these are sent directly to the PALS service, the Patient Advice and Liaison Service, and on the whole, it's all very positive. Patients love coming to us. They always have such positive experiences. And I think that's, again, just testament to how brilliant the team are and how well we work together, not just with each other, but with our patients. So, yeah. And then just a little bit about me and my journey. So I first met Sally and the team way back when, 2 years ago, in 2021, around this sort of time, when I was a student nursing associate there on placement. That was my 3rd placement. Yeah, 3rd placement. So I was just starting my 2nd year of training, had no experience of wound care, of wound management, didn't even know what a leg ulcer was at the time. I was very naive. And I know, and now look at me. So yeah, and then fast forward to summer last year when I qualified, got my PIN, and invited back to join the team. And I've been welcomed in by the whole team. Everyone's been amazing. I'm actually also the only nurse, as far as I'm aware, the only registered nursing associate in the whole of the hospital. So that's quite something, isn't it? It's amazing to be able to fly the flag for the nursing associates, and pioneer what we do. And Sally and the team have been instrumental in that, and having me as part of the team, I suppose, was perhaps a risk some might see it as, or have seen it as, but I really wanted to integrate myself into the team and demonstrate that nursing associates are more than just the bridge between healthcares and registered nurses. Saying that, this is my journey so far. So I've been working with the team for just over a year, coming up to 1.5 years now. And I actually went on to start my registered nurse training as well with the support of Sally and the team. So I currently work part-time at the women management clinic, and then most weekdays I'm at uni. So no rest for the wicked, as they say. But so it's keeping me on my toes. But again, I'm incredibly well supported by the team, and there's a lot of crossover. There's a lot of thanks for the claps, Kylie. There's a lot of crossover. I'm currently on a leadership placement, so actually working with Sally as a student nurse in a slightly different role to my nursing associate role is really interesting, because I get to see a little bit more about what she does to support the team and lead the clinics, and all the sort of goings on behind the scenes that you don't usually see. So yeah, so all being well, in sort of June, July next year, I will make the transition from green to blue. But I will still always advocate for the role of the nursing associate. I'm so proud to be one. And you know, the role is still in its infancy. It's only about 5 or 6 years old really in England, but that's changing, and we're getting more sort of responsibility and roles, and we're getting our name out there, which is really important. And yeah, absolutely. So it's, you know, we do more than just bridge that gap, as people often say. We've got a PIN, we're registered with the Nursing and Midwifery Council. We can do many duties that registered nurses can also do, which allows us to take sort of the workload off them, allowing them to free their time to focus on more complex clinical care. So I do feel, not to blow my own trumpet, but I do feel that I've been a bit of an asset to the team. I've been able to support both registered nurses and healthcare assistants in their roles. I've also been able to act as a practice supervisor as well for some of our students, helping to teach them about the principles of ANTT and such, and educate them on wound care, and help them sign off proficiencies and achieve academic requirements, which in my sort of first year of being registered, I never expected to be able to do. And I'm only 2 years post being in their shoes myself, so it's quite bizarre to think that people are coming to me for knowledge and advice. But again, testament to the team and how well they've nurtured and supported me within my role. And of course, we do massively pride ourselves on the service that we provide. Obviously, we're hugely humbled and honoured to have received this award from CHA, but also we're often recognised for our efforts through the WOW Awards scheme. Quite recently, lovely Sue, our matron, actually nominated us for an award as well. And it's just a really great way of being recognised for the work that we do. And so we've had peers, colleagues and students nominate us for awards as well. So to be recognised is really wonderful and definitely boosts team morale. And just looking ahead to the future, so the clinic is constantly evolving and changing and moving forward with the times, with healthcare and the ever-changing world of nursing. And what's really exciting is we're actually hoping to get another nursing associate into the team very, very soon. So I won't be the only one, which will be really nice. It'd be nice to sort of share that role and those responsibilities with someone else and have them to bounce off of. And it'll be nice for them to integrate within the team and see how well I've done within the team and how they can succeed in their career as well. So there's a real emphasis on growing your own. You know, we've had healthcare assistants who we've again put through registered nurse training. We've got one of our amazing nurses who's about 2 years qualified now, and she's moving up and going to become a band 6 soon. So you know, there's real room for progression and growth, and we're really a nurturing team and a really supportive team, which I think is so paramount. And of course, goes that saying, we're super duper proud of our achievements. So there's a little picture of some of the team receiving the award, and we're just again hugely grateful to be recognised for our efforts, and this will just keep spurring us on to keep doing the amazing work that we do. We're really proud. We love what we do. There's a reason we're running, 7 days a week, 365 days a year. There's a reason I came back as a registrant after being a student. I had a load of placements that I, had offered and experienced, but I wanted to come back to Sally and the team because it's where I felt the most welcome, and it's where I felt I could demonstrate the best abilities that I could as a nursing associate. So that's me, and that's just a very, very brief overview of sort of my experiences over the last 1.5 or 2 years as a nursing associate.
Oh, can I say thank you to both of you for the brilliant presentation you've done and shared with us this evening.